Hey guys, what's going on? It's Amy again with Bargain Mama, and today is Wednesday, like the 9th or something, I think. So I just wanted to give you all an update. As you all saw, the other video I posted that I had to have an emergency gallbladder removal. Excuse me, I'm so sorry. No, bud. So Thursday was the 4th of July. I was fine, perfectly fine. Felt nothing. Friday morning, got up, was getting ready for work, and I was perfectly fine. I live about 45 minutes from my work. It takes me about 10 minutes to get to the interstate, and then it's about 25 minutes on the interstate, and then another 10 minutes off. So I'm on the interstate for about 25 minutes. So I get ready for work. I'm fine. I give my husband a kiss, and I leave, and I would say, I get about 25 minutes into my drive. And, so when I got to the interstate after about 10 minutes of driving, I started noticing that I was felt like I had a pulled muscle on my right side. And so, I'm just wiggling around in my seat. And then I realized it's starting to get a little bit worse. So I undo my pants. I mean, I'm trying to think, what is going on? And of course, I'm what is this, gas? What is happening? So I keep driving, and I'm about 25, 30 minutes. I would say maybe 30 minutes into my drive at this point. And at one point, I was I have to call 911. When I ask my patient if you're in a 10 out of 10 pain now, and they're laying there yeah, I'm in a 10. No, I can assure you, I felt in that couple of hours what a 10 out of 10 pain was. And I didn't even know what I was going to do. So as I'm getting so I'm not to my work yet. I still have about 10 minutes left on the interstate. And I said, I can't keep driving. It was on my right side. I drive with my right leg. I was sweating I've never in a million years. I was what is happening? And I'm still this has to be gas. What is going on? So I pull off, and I'm thinking I'll stop at a gas station and stretch or something to get this bubble out. The pain ended up getting so bad as I pulled off the interstate. I Googled the nearest emergency room. That's how bad I've never had to Google a hospital. So, and I'm thinking, I'm not going to make it to this hospital. I remember looking, it was 1.6 miles. And I remember thinking, I don't think I can make it 1.6 miles. But if I stop my car right now, I'm going to have to call 911 from the side of the road. I know this all sounds extremely dramatic. I've had 3 children. I don't ever remember this pain, and maybe it was because when I had my children, I knew the pain was coming. At some point, I was fine. Like I said, I was on my way to work, not one little bit of pain, and then the pain, like I said, I couldn't even take. So then I Google myself to the hospital, and I get out, and I'm okay, I'm still at this point, let me just go in and try to go to the bathroom, because I don't know what's happening. So I go in, and I'm just hunched over. Apparently it was not the best hospital to stop at. I mean, a hospital is a hospital, but when I go into the bathroom, there's razors everywhere and people sleeping on the floor. I didn't even care. I did not care. So I go into the bathroom, and I'm sitting on the toilet. And when I sit on the toilet, I just think, I can't get up from this toilet. That my pain is so horrific. What is wrong with me? And so I finished. I didn't even have to go to the bathroom. And I walk up to the counter. I've never been in this much pain in a place I don't know. I live in Tucson, but I do not, like I said, I drive 10 minutes to the interstate. I take the interstate all the way to work, and then I take 10 minutes off the interstate. So Tucson is extremely big. I do not drive in it. I don't usually, if I'm going, I will Google myself to a Dollar Tree or something, or a Walmart or a Dollar General, but I do not just drive around Tucson sightseeing. I just don't. And so I had no idea what part of town I was in. I mean, like I said, I had nothing. And so I go up to the counter, and again, as I start looking around, I see a lot of homeless people. And it's not even just I see this guy sleeping over here with no shirt on and no shoes. Then I see another person over there picking bugs up off the floor, but there wasn't any bugs. And then I'm just it's just very nerve-wracking, because I'm I don't even know where I'm at. Do I even need to be in this emergency room, even though I knew that my pain was horrific? I'm thinking I have gas, and this is super embarrassing. So I tell the lady, but because of the area it's in, their windows do not open, so they are talking through a little hole in the glass, and I'm in so much pain I literally can't hear her. And she asked for my ID, so thank goodness it's in my phone, so I hand her my ID, and then all of a sudden I start gagging. And I said, oh, do you have something I can throw up in? Well, apparently normally they have the throw up bags out there, but they were out. I literally was standing at I was on one knee outside of her counter with my head down, gagging. And not because my stomach was nauseated, but because the pain was so horrific, I didn't even know what was happening. Again, I'm just what is this? I know I keep saying that. No. I know I keep saying that, but there was no reason for me to be feeling like that at all. So, anyways, she takes all my information. I go and I sit down, and it kind of subsides a little bit, but then it starts coming back really bad. So then I try to go back to the bathroom because I'm I don't know if I have to go poop. Again, I didn't know what was happening. But apparently there was a man in the women's bathroom and a man in the men's bathroom. No, thud. And so I'm you guys have another bathroom? And they're no. And so I'm just sitting there oops, sorry, thud, no. You don't come over and hit me like that. He just came over because he wanted to be petted and just smacked my arm. I'm sorry. So anyways, I'm sitting there, I'm trying to find a comfortable spot. Again, don't know anyone. I think I was not in the waiting room. This is one thing I have to say about this hospital, okay? So again, people are oh my gosh, that's the worst part of town to be in the hospital, blah. Let me tell you, by the time, I think I checked in at I think it was 9 o'clock. And when I got out, I was diagnosed and everything by 11:30. I mean, amazing. The people were super nice, the nicest people I've ever met, super made me feel comfortable. I even told them that. I said, thank you guys so much. You guys made me feel so comfortable in a position where I was not comfortable. So anyways, I think I was in the waiting room when I called my husband and I said, I'm in St. Mary's Hospital. And he said, what? I had just given him a kiss and said I was on my way to work. And he's what are you talking about? I was I don't know. Something is wrong with me. I said, you don't have to come over here. I'm sure it's nothing. And he's no, I'm on my way. But I was no, anyways. So then they call me to the back, and they take my blood pressure and everything. And then they take me to a room. And so when I get to the room, there was already a nurse in there. And that's what I'm saying. It was such an amazing hospital. It was so amazing. But so where my room was, so I've been, I've worked in a hospital. I do all this. Usually the rooms, it's a door. It's almost I want to say a jail cell. There's no window, so you can't see out. Well, apparently because so much stuff happens in this hospital, there is windows in all of the emergency rooms that you're in, so they can see what you're doing inside there. But my room was right here, and as I'm staring directly down the hallway, that's where the emergency exit was. Where the ambulances and stuff came up, there was probably 10 rooms along the left over there. I'm not kidding. After watching 5 corrections people come in, because apparently that's also the closest hospital to the prison, and then watching all these other people come in, it's so sad. I was sitting there thinking if somebody comes in through that emergency room door, because it's the sliding glass door that the ambulance comes in, so it's sensor. It's just if somebody walks up, I thought, where am I going to run to if somebody comes in that door and starts shooting? It was just crazy things I was thinking of, and I was also in so much pain. So anyways, the doctor comes in super fast and he says, it's either gallbladder or you have a kidney stone. And I said, well, I don't know. I'm trying to tell him what happened or whatever. And so my husband shows up and my pain is subsiding a little bit. I'm also on morphine and some relaxing agent, which I gotta say, the relaxing agent they gave me that was not a narcotic worked so much better than the morphine. Yeah. So anyways, I go back to CT and I come out. And as I'm sitting there, the doctor, he says, yes, I knew I was right. And I was what happened? And he's it's a kidney stone, 6 millimeters. And I was what does that mean? And my husband was well, mine was 4 and I thought I was going to die. And he was it's the size of a pencil eraser. And he's so it's extremely big, but it's in the bottom of your urethra. So we're just going to kind of let and see if it passes or not. Okay. So this was Friday. And I was okay, whatever. And so they're here's some Percocet. No. Yes. So he was like, here's some Percocet. I'll send you home. You need to make sure that you're peeing. And if your pain gets worse again, come back to the hospital. Which, again, that would not have been the hospital I went to because that was 35 minutes from my house. So we leave my car there. My husband brings me home on Friday, and him and his mom go get my car. And then I still haven't seen my car since Friday. It's at my mother-in-law's. So then Saturday, I'm like, okay, I'm feeling a little better. I go to my niece's baby shower, and I was like, whoa, like I'm feeling bloated. I feel like I'm not urinating, and I feel like my pain is getting up to a 3. But I remembered how fast my pain got up driving to work. And I was like, there's no way in a million years I could ever do that 10 pain again. Because even in the hospital the day before, the doctor was like, I almost forgot to ask how you're feeling right now because you look so much better than when you first came in. He said you were sweating and you were writhing in pain. I said, I've never been in that pain. Like, it was to a point to where, like I said, I was gagging, and like I didn't know if I should scream. I didn't know like what I should do. Like, it is just so frustrating because it was like nothing I could do. So anyway, Saturday, I'm like, no, babe, something is not feeling right. So we go to the hospital that's closer to my house, and we go to the emergency room, and I just tell them, I'm not feeling good. Here's the paperwork from I was just in the emergency room yesterday, all this. They do a CT scan, and they said, well, one good thing and one bad thing. And they said, the good thing is you somehow managed to get rid of that 6 millimeter kidney stone. And I was like, oh, thank goodness, because people are telling me it's still going to hurt and all this. And he says, the bad thing is it looks like it was your gallbladder and the kidney stone that was bothering you. Your gallbladder is extremely inflamed. There's, what did they keep calling them? Like the name they kept using was so weird, like googly, I don't even know, but I was like, that sounds like something from the Ghostbusters, like what they kept calling it. But so anyways, he said, I'm going to talk to the hospitalist, because that was just the emergency room doctor, but I think that we should keep you overnight because it was a newer hospital that I was at, so they didn't have ultrasound till 8 o'clock the next morning. And I was like, well, can I come back tomorrow morning? And he's like, the problem is we need to start you on antibiotics immediately because you do have an infection, and we would hate to send you home and something happens with your gallbladder. So I go upstairs and I stay the night. That was Saturday. So I got sent home on Friday with a kidney stone. On Saturday, my kidney stone was gone, but then they said my gallbladder was bad. So I had to stay the night Saturday night. Sunday morning, they come in, they do my ultrasound and everything. And then I'm just chilling there. I don't even know. And by the way, I can't eat anything. Okay, so I haven't eaten anything really since Friday because I hadn't been feeling good since Friday. So then Saturday I went to the hospital. I was admitted. Sunday, I got my ultrasound done in the morning. Yes. And then the general surgeon came in. It was probably like 4 or 5. And he said, it looked like you might just have a urinary tract infection. It may not be your gallbladder. And I said, oh, okay. So can I go home? And he was like, well, I think, let me go see if they cultured it. Let me go see this and this. So I said, okay. So I call my husband and I'm like, oh, it's looking like it's just a urinary tract infection. And I might be able to come home tonight because my husband had been there all day. And I don't know about you guys, but I don't like for people to be at the hospital with me. It is super sweet and nice, but I feel like I have to entertain. And I was so exhausted because A, I wasn't allowed to eat. B, I was on morphine and goodness knows what else. And I was just so exhausted in general that I didn't even want to be awake. And so I had been begging my husband, like, please, like his sister was in town. I was like, can you please go home? I promise that my hair is not greasy. I just washed it yesterday. But I'm just, yeah. So anyways, so that was Saturday night. No, I'm lying again. Sunday night. I'm sorry. So I said, I think I can come home. I think it's just a urinary tract infection. He was like, oh, okay, great. And I said, yeah, they're not going to do surgery on my gallbladder. They might be able to do it outpatient if it gets worse. And he was like, oh, great. I would say like a half hour later, the general surgeon comes back in. He says, so I was mistaken. And I said, what do you mean? And he's like, well, where I normally work, these numbers mean that you have an infection. But when I called down to the lab, they said that no, they didn't culture your UTI because it's not you don't have an infection. So your gallbladder has to come out. And I said, whoa, wait, what? This at this time was like probably 6 o'clock or something. And I was like, wait, what? And he was like, yeah, it has to come out. And I was like, tonight? It's 6 o'clock at night. And he was like, yeah, it's gonna have to come out. I gotta go get my team. And I was like, so then I call my husband and I'm like, oh, by the way, they're taking my gallbladder out tonight. And he's like, wait, no, like I'm not even home. I haven't. And I was like, I know, I'm sorry. So anyways, so my husband, I'm like, don't come back. Like, there's no need to come back, like to rush back before I go in. I don't know how long I'm going to be in there or whatever. But of course, my husband rushes back. And then like an hour later, this guy comes in and I was like, hi. And he's like, are you whoever? And I said, yes. And he says, we're the team. I said, oh, okay. My doctor said that the team would be in. He's like, yeah, that's us. We're the team. So they take me down. And, you know, you have to wipe up with all these swabs, these things first. But then I guess they have a new thing where you have to actually, so this is what I thought was weird. You guys have to tell me. There's like a toothbrush that, not like a normal toothbrush, like one that's in surgical stuff that's been like sanitized, and you open it up and it has like, so he breaks it, right? So it looks like it would be like a nose cleaning thing, but it's a toothbrush. And he breaks the thing and toothpaste like busts open inside of this thing. And so out you take the toothbrush, which now has toothpaste, and you brush your teeth with it. And then there's like a swab in there that also has the toothpaste on it. And like you clean your tongue and the top of your mouth with it, and then you throw those away. And then there's this thing that he actually has to go up. I was like, are you doing a COVID test? And he's like, no, it's because we have to clean the inside of your nose. And I was like, what? And he's like, yeah, we've learned that that's where things come from, all this stuff. And I was like, so yeah, like they're like prepping the inside of my nose, the inside of my mouth, which, I mean, great, I guess, but I had not had to go through that before. So, and I don't know about you guys, but I will always try to be the one that tries to fight the anesthesia. I'm like, I can stay awake, and then I remember waking up after it. I didn't even get a chance this time. That guy, he was like, you guys ready? You guys ready? And then just pulls the needle out of his shirt. And I was like, well, you were ready. He's like, I got it ready for you. And he gave it to me, and I was feeling great, and then I just passed out. But when I go to sleep, my respiratory rate drops to like 43, which is super nervous to other people, but it's my normal, which is not normal for a lot of people. So apparently they had the mask on me to keep breathing in the, like the gas mask stuff, but it didn't work. So they had to intubate me. Let me tell you, I have still been coughing up stuff. So today is Wednesday. So I've still been coughing up everything. Oh, it's horrible. So that was Sunday night. So then I get back up into my room. And then, so Monday, I'm like, no, I'm going home. And they're like, oh no, you need to stay. I'm like, no, I had my gallbladder out. People do this in an in and out procedure. I just got my last dose of antibiotics, which couldn't be done orally. They could only be done like through an IV. Why am I just going to sit here? Like, I can watch myself at home. I have people at home to watch me. Literally, I wasn't even on IVs anymore. They had taken my IV out. And they're like, no, we're going to need you to stay. I said, I will leave AMA. And I was not trying to be mean, but I was like, why am I going to stay here? Like, I've been in and out of the hospital since Friday. It's now Monday. I'm sorry. My dogs are waiting for their Amazon order. Their dog bones are coming in, and they are waiting. But, so, today, let's see, I had my surgery done on Sunday night. Monday night, Tuesday night, Wednesday. So we're on day 3. As some of you know, 2 years ago, I had a total hysterectomy. The total hysterectomy was a piece of cake compared to what I'm going through with my gallbladder. I cannot believe the pain. So with my total hysterectomy, I didn't have to take pain medication after the first day, nor stop. Like I was doing good. I mean, I'm up and moving. I walked around on Safeway today with my husband. I've been up and moving a lot. I didn't have to wear my abdominal binder as long. I have to wear my abdominal binder right now. Like, oh my gosh. My, I only had 3, I believe, incisions from my total hysterectomy. I have 5 from this one, and they're much larger. And they're going to be ketones because they're definitely like bubble. No, thud. But you guys, if you've had a gallbladder, please tell me what to do, because I just can't. Like, I don't know if it's the gas pain. I don't know what it is, but I am like, I try not to take anything during the day. And today, I didn't take anything during the day yesterday for pain, but today I had to take something because I just couldn't take the pain anymore. But so we're on day 3 of recovery. I had my surgery on Sunday night. I plan on going back to work on Monday. I'm hoping. And I really plan on getting back to my YouTube. I was actually super excited about that. I have a desk set up. I have my whole little office set up now. Like, I was super excited. And this happened. But I promised to get back onto my YouTube because I do miss, like, the videos and all that stuff. But I just want to come on and do an update and tell you guys I'm doing great. In my personal opinion, my gallbladder surgery is worse than my total hysterectomy. So, yeah, I don't know. But if you guys have any suggestions, let me know. Today is Wednesday. Like I said, I'm hoping tomorrow will be a better day and I'll be able to do some videos. The problem is I have to bring stuff in from my garage into where my new desk is and stuff. And, I mean, I can do it, obviously. But, oof, I'm telling you guys, like, so it wears me out. So it's like what I tell my patients, do what you want to do versus what you have to do, because it's hard. It's hard. Like, I don't know. But anyways, guys, thank you so much for listening to this long emotional thing. So yes, in the past week, I have had a 6mm kidney stone and I've had my gallbladder had to be taken out. So with that being said, I think I'm doing great. I hope you guys have a great day. Thanks for listening to me and everybody's at work and school, so I have no one to talk to. Could be doing a lot of little vlogs lately. All right, guys, I hope you have a great day. Bye.